morning. I'm Paul Irwin, Dean of the School of Public Health at UAB. And on behalf of the school, I want to welcome everyone to this final event of National Public Health Week, the State of the County address by Dr. Mark Wilson, Health Officer and Director of the Jefferson County Department of Health. We have been in the throes of COVID-19 for so long that some of us have difficulty remembering what our pre-COVID world was really like. As it pertains to today's session, that world for me was an occasional conversation with Dr. Wilson, getting to work with him and others at the Jefferson County Department of Health on problems such as gun violence, the opioid epidemic, and the North Birmingham Superfund site. And then came COVID. In the past year, there has almost never been a week when I wasn't on a Zoom call with Dr. Wilson, sometimes several in a single week, working with him and others at the Jefferson County Department of Health to bring all of our knowledge and experience to bear in combating COVID-19. Of the many things I have learned, I can say emphatically and without reservation that Jefferson County is fortunate to have Dr. Wilson as the health officer here. His knowledge and expertise almost go without saying, but it is always good to reiterate the importance of the knowledge of science when confronting problems such as a pandemic. Perhaps equally or even more important has been his judgment, his instincts, his insights, and his ability to see the big picture and anticipate unintended consequences of action. Dr. Wilson, thank you. And thanks to all the Jefferson County Department of Health employees for all that you have done during the pandemic. Because of your work, we can hope for a very near future when we can settle into a new normal. Before I turn the podium over to Dr. Sag to formally introduce Dr. Wilson, allow me to invite you to watch a brief video that highlights some of the challenges and successes that the Jefferson County Department of Health and our community have had over the last year. Thank you for participating in this webinar with us.
Hi, I'm Dr. Mike Sag. I'm at the University of Alabama at Birmingham, and I'm a professor of medicine and infectious diseases here. Like all of us, I got thrown into the COVID epidemic very early on. I actually had COVID myself, one of the first people in Alabama to have that. And I know firsthand the horror and the suffering that's associated with it. So far, we've had over 31 million of our fellow citizens in the United States who have been infected with COVID, and that number continues to grow. We're not out of this yet. In areas like Minnesota, Michigan, New York, Rhode Island, New Jersey, the cases are starting to increase again. So we really need to keep our guard up. In Alabama or Jefferson County right now, we've had almost 1,500 deaths from COVID. In the state of Alabama, nearly 11,000 deaths. And in the United States, we just crossed 565,000 deaths due to COVID. Right now, I'd like to ask all of us to have a moment of silence in memory of those we have lost to this epidemic. Thank you. It's hard to believe how far we've come and how many people we have lost. But a lot of people have not lost their lives due to the heroic work of a lot of folks in public health. And chief among them in Jefferson County is Dr. Mark Wilson. Dr. Wilson is the Jefferson County Health Officer. He leads the Jefferson County Health Department, and he's been doing that since 2011. During his tenure, of course, he's focused on the COVID epidemic, and very recently was given the 2021 Albert Schweitzer Fellowship Award for Alabama for his work leading us in Jefferson County and throughout the state of Alabama in fighting COVID. But they do so much more at the Jefferson County Health Department to protect us every day. Dr. Wilson's been leading efforts to focus on drug addiction and opioid use, on improving birth outcomes and reducing infant mortality, and addressing HIV and viral hepatitis that's ravaged a lot of our community, promoting outdoor activities and supporting the development of the Red Rock Trail system, and of course, promoting health equality. He gets that background from work he had done earlier in his career at Mercy Hospital, Cooper Green, where he served as the leader of the outpatient group. And he also was highly active in leading that entity to taking care of a lot of folks who did not have medical insurance in the Jefferson County area. Dr. Wilson originally went to undergrad at Georgia Tech, where he received a degree focusing on engineering, and then went to University of North Carolina, Chapel Hill, where he received his MD degree. He then went for a year internship at Grady Hospital in Atlanta. A lot of you know that. It's another county indigent hospital. And then finished his residency training at the Carolinas Medical Center in Charlotte. He's married. His wife is Marion. They have 4 grown children and have a grandchild on the way. That's very exciting. He actually plays cello and does so at the Altadena Valley Presbyterian Church. And he also works as a community volunteer in the Community of Hope Health Clinic in Shelby County, and participates in numerous medical mission trips, serves on a lot of boards and advisory boards and committees related to public health. He enjoys gardening. He's a runner and has run in many marathons, not many marathons, but MANY, many full marathons, including the Boston Marathon in 2018. Dr. Wilson, it's a joy to welcome you and to hear your remarks.
Thank you, Dr. Sag, for that kind introduction. And thank you, Dean Irwin and the UAB School of Public Health, again, for hosting this event as you have in years past. And thank all of you for just spending a little time with us today. Back in the early part of 2020, I remember looking at the threat of COVID-19 and the impact it was likely to have and the all-out coordinated effort it would take to fight it and the sacrifices that would have to be made. And I remember thinking that this would be like total war. Many people have hearkened back to World War II for an apt comparison. We hoped we would rise to the occasion like the great generation of that time. I'm not sure we fully realized that hope because unfortunately we failed to maintain the unity of purpose and resolve we had hoped for. And I'm afraid this resulted in many lives lost. At the same time, there are many heroes in our community to be celebrated. In order to fight a major war, you have to have a functioning military apparatus, and you need to have allies. We all know the story of Great Britain doggedly standing up to the Nazi regime in the early part of World War II, refusing to give up in the face of unfavorable odds. There was no way they could have prevailed alone. It required the entry of the United States and other allies into the war to ultimately win. So today I want to talk about our regular army, if you will, the Jefferson County Department of Health, and our allies, and how we fought this war over the past year. And then I want to talk briefly about the post-war period, a few of the public health challenges and priorities that continue going forward. By reviewing this today, I don't want to in any way imply that that war is over. It is not. We still have a lot of work ahead. The variant strains of the virus are a real threat. As Dr. Sag mentioned, several other states are seeing increases in cases and increases in hospitalizations, including unprecedented cases or rates of hospitalizations among younger adults. So we can't let our guard down yet. We must keep fighting. But as we are about a month past the anniversary of our first case in Jefferson County, I do want to spend some time recognizing and thanking the many people who have fought valiantly since that time. First, there was preparation that occurred starting in January of last year. JCDH has a small emergency preparedness team that helps make sure that the health department and our partners are prepared for public health emergencies. In fact, this department and local partners, including the Jefferson County Healthcare Coalition, had conducted exercises to help prepare for a possible pandemic. Our health department has people who are trained in setting up the Federal Emergency Management Agency, or FEMA, incident command structure for emergency response. We have people who have experience in working within an incident command structure because we've used it before in the aftermath of tornadoes, for Ebola, for Zika, and more recently, an ongoing hepatitis A outbreak. JCDH set up incident command for COVID-19 on January 25th, 2020. In incident command, you can start small with structure that you can later build out as needed, depending on the size and complexity of the situation. It also supersedes the usual hierarchy of your organization, so you can recruit people and assign duties for whatever is needed. On March 27th, 2020, the FEMA administrator issued a recommendation that state and local governments integrate all emergency management and public health operations. So soon after that, our health department's incident command joined with the Jefferson County EMA to form a Jefferson County Unified Command. This allowed us to garner and coordinate support from multiple local governments and other organizations to meet the needs of the community. Not just the public health response to the disease, but as examples, to make sure people who were out of work or children who were out of school had food to eat, or to make sure that our first responders and others had adequate supplies such as N95 masks and hand sanitizer. I remember thinking to myself at that time, using that World War II analogy, that our health department was like England and the EMA was like the United States coming to our aid. We're still in unified command today. Another branch of our military, if you will, that started preparing early was our legal team. They began reviewing the process for quarantining people, making sure the process and necessary documents were in place, including what to do if someone refused to voluntarily cooperate with a quarantine order. Our legal team worked closely with me to put together the first public health orders issued on March 16th, including the legal basis in Alabama law that authorizes and requires county health officers to institute immediate measures to prevent the spread of a notifiable disease. Note that the State Board of Health had earlier declared COVID-19 to be a notifiable disease in accordance with state law. I have to express my gratitude for legal counsel David Maxey. He has been a great help to me, really a mentor in many ways during my time as health officer, along with his team at Spain and Gillen Law Firm. They worked long hours, including weekends, helping to prepare orders such as these social distancing orders in March and the first countywide face mask order in Alabama, which I issued in June. As the pandemic got underway, we mobilized more and more of our own health department workforce to respond. Our public relations department worked with other local governments and hospitals to form a joint information center very early, which helped assure that we communicated important information to the public in a coordinated fashion. Our language department made sure the messages got to people with limited English proficiency. Clerical staff were helping us issue quarantine orders. Environmental health staff helped assure that businesses open to the public were complying with public health orders and responding to complaints from the public. Staff from multiple areas in the department were diverted from their usual duties to help with contact tracing and testing efforts. Our information systems staff set up dashboards for pandemic-related data so the public could see it. And as case numbers increased, our human resources department helped us hire extra temporary staff to add additional contact tracers. Our finance department helped us acquire grant funds and properly account for their use. And more recently, many of our employees have stepped out of their usual roles to help with the vaccination effort. Many others at JCDH made adaptations in order to continue safely providing certain essential services to the public, such as primary health care, social services, nutrition services, family planning, treatment and control of other communicable diseases, and critical environmental protection. Our overdose to action team innovated to make sure naloxone continued to be distributed to people in our community who can respond to opioid overdoses. These are the people that work in our regular public health workforce. So often they're under-recognized, but they have been there for all of us during this past year. And I hope you will join me in giving a great big thank you to our public health department workforce for their service. I'm personally very grateful to them, and it's a real honor for me to have had the privilege to work alongside them. As great as our regular workforce is, there is no way you can fight an enemy as formidable as this without a lot of allies. Going back again to last year, during the week of March 9th, we saw new cases in all states bordering Alabama, but none had been reported here yet. Because so little testing was available at the time, we knew it was very likely that we had undetected cases in Alabama at that time. And I felt that the greater Birmingham area was particularly vulnerable due to our interstate travel and our population density. There were several large events scheduled for that upcoming weekend. On the morning of Thursday, March 12th, our Director of Disease Control, Wes Williford, and I consulted with Doctors Jeannie Marazzo and Rachel Lee of UAB Infectious Disease about limiting large gatherings and talked about what that size limit should be. We finally decided we just needed to pick a number and get the process started towards reducing the risk of spread. That afternoon, I called a news conference and announced a public health recommendation that gatherings of greater than 500 people be canceled. That next day, March 13th, we had our first documented case of COVID-19 in Alabama and our first case in Jefferson County. And I issued my first COVID-19 quarantine order. Also on that Friday the 13th, Mike Sag, another strong ally, wrote an op-ed in AL.com, which included these grave warnings. He said that our state was about to be hit by a major storm, and we could expect a doubling of the number of cases every 5 to 6 days if we did nothing. And that if we wait much longer, our healthcare system would become destabilized from the onslaught of COVID-19 cases. Dr. Sag and I communicated over that weekend, and he influenced me to act more urgently than I probably would have otherwise. I spent that weekend reviewing shutdown orders from other places in the country and consulting with the health department's legal counsel to draft orders. More than a year later, it can be easy to forget that what we were facing at that time, how threatening it was, how much was unknown, and how much we were concerned about the lack of resources for testing and for medical care. Front of mind were horror stories coming out of places like Italy, where they were having to ration ventilators. I thought about the emotional trauma healthcare workers here might experience if we were to have a similar scenario. This was very personal for me. Many of those healthcare workers are my friends and colleagues. Two of them are my own daughters. Also front of mind was the story of a nursing home outbreak in the Seattle area. And I was really concerned about our own nursing homes, as well as other congregate living situations such as our jails and our homeless shelters, which were very vulnerable. On Monday, March 16th, with the assistance of the Jefferson County EMA, I held an emergency call with the Jefferson County commissioners and all the mayors in Jefferson County. I invited Dr. Sag, Dr. Marazzo, and Dean Irwin to explain the seriousness of our situation. And then I proceeded to discuss the social distancing orders that had been drafted over that weekend. As far as I could tell, there were no objections from the elected officials, only a couple of questions for clarification. That afternoon, we held a news conference announcing a Jefferson County Health Officer emergency order. Also speaking at the podium was Commissioner Jimmy Stevens, representing the county elected officials and our Board of Health, along with EMA Director Jim Coker and the United Way CEO Drew Langlow, who were mobilizing to provide support in our community for what we knew was a difficult time ahead. That first order suspended public gatherings of 25 persons or more, closed restaurants and bars to indoor eating or drinking. It's interesting that at that time, that order was meant to expire after just 1 week. That order also included measures to protect our seniors and nursing home residents, among other things. The state health officer, Dr. Scott Harris, extended a nearly identical order to surrounding counties the very next day. And within a week, there was a statewide public health order. I would be remiss if I didn't mention Dr. Harris here. He's been a wonderful ally throughout the pandemic, and he's had a really tough job. I don't envy him knowing what he's been through. There are ways we can look back and second guess the specifics of early public health orders and recommendations. But it turned out that we were right when we suspected that there were a lot of undetected cases in Alabama at the time of that first recommendation, first order. Because about 2 weeks later, several started showing up in our hospitals with a really steep increase in what looked like a tsunami of hospitalizations. It was really alarming. But then, after a few days, the hospital numbers leveled off. The shutdown orders had the desired effect of flattening the curve at that time. While shutdown orders have certainly been controversial, and some argue they don't work, I believe that during those first days, those early weeks, they did save lives. And remember, this is when we had limited PPE and when we didn't know what we know now about effective treatments for hospitalized patients. That first meeting with elected officials was the first of many. We considered various strategies together, and they helped reinforce our messages for people to stay safe, especially early on. I called on many of our elected officials individually for counsel, and they sometimes called on me. While some of them didn't agree with me 100% all of the time, especially as the pandemic became more politicized, they remained important allies, and I value the relationships with them that have grown along the way. We continue to provide updates and discussion via Zoom calls with our elected officials every 2 weeks, as we have done through the entire pandemic. There have been so many allies throughout the various phases of this pandemic. that it's impossible to list them all here. But I'll mention some just to give you a sense for the breadth and scope of those on the list. Our local hospitals and their staff. I was on regular calls with CEOs of our local hospitals as they coordinated their efforts. Initially, to preserve PPE and other resources in short supply and to establish policies to protect their patients and their staff. And then to provide testing and later vaccinations. They all stepped up in major ways and at great sacrifice to save many, many lives. I have a huge amount of admiration and gratitude for their work. UAB in particular has made many tremendous contributions in addition to the direct care of COVID-19 patients. In the vaccine rollout that's going on now, they have been by far the #1 provider of vaccinations in Jefferson County and in the greater metropolitan area. The UAB School of Public Health has provided much needed expertise for us. Several of our local outpatient healthcare providers, such as Cooper Green and our federally qualified health centers, or FQHCs, and some of our urgent care centers stepped up to provide a large volume of COVID-19 testing and are now actively involved in providing access to vaccination, including access in our more vulnerable communities. There were a bunch of volunteers in our sewing community who stepped up early to sew face masks, including an amazing group called Birmingham Face Masks. They made them for people in our more vulnerable populations, for our first responders, and for others in the community. They were even making them for our healthcare workers because early on, we had a genuine concern that our frontline healthcare workers could run out of medical grade face masks. Our community of nonprofit organizations stepped up in major ways to support the community. There was the United Way, as I mentioned earlier, and also the Community Foundation of Greater Birmingham, the Birmingham YMCA, Christian Service Mission, and many, many others. Our local schools deserve special mention. This is where some of the greatest challenges and controversies occurred. But I want people to understand how much collaboration went on into our work with the schools. We have worked with them throughout the pandemic. Our disease control staff started with an information session for school leaders in the lead up to the pandemic. And the schools reached out to us for advice as we got into it. They reached out to us to discuss graduation ceremony plans in the spring, and then for fall school reopening plans. In late June, the State Department of Education released a much anticipated document titled Roadmap to Reopening Schools. It was sound guidance, but it didn't include specific guidance about reopening. Specifically, whether to go virtual or in person. In mid-July, our health department held a meeting with our local superintendents and private school leaders to provide information and updates on the COVID-19 situation and the amount of disease spread we were having in our county at the time, which was considerable, and to answer whatever questions they had. The information was very well received, and at the end of that meeting was a request made to me as health officer to provide more specific opening recommendations. I then convened a group of advisors, including local pediatricians, infectious disease, and epidemiology experts, to draft some recommendations. It should be noted that many of these advisors were also parents of kids in our local schools. On July 23rd, I had a follow-up meeting with school leaders where I shared the draft recommendations and received their feedback, made some adjustments, and then on July 27th, I publicly issued a memo to school leaders in which I recommended full in-person school for primary grades with strict mask wearing and other precautions. And for the secondary grades, whether to go either all virtual or hybrid so that they could reduce class sizes by at least 50% for the first 9 weeks. This was based on evidence at the time that small children did not efficiently spread coronavirus infection to adults, but that children over the age of 10 did seem to spread the virus as efficiently as full-grown adults. This was also when we were in the midst of the summer COVID-19 surge, and our hospitals were then experiencing significant strain. I made some minor revisions later that week based on some concerns that were relayed to me by some of our elected officials. I spent the next several weeks after school started communicating with superintendents, teachers, parents, and a few school counselors to see how things were going. I was trying to weigh the infectious disease concerns with the very important concerns over children's academic, emotional, social needs, and their mental health, all of which have important societal and public health implications. While the hybrid model for the older students was helpful in establishing disease mitigation measures in a more manageable way early on, it became a struggle for many students, parents, and teachers. We didn't meet the community COVID-19 metrics we had hoped to meet before recommending resumption of full in-person classes for secondary schools, but neither did we detect major disease outbreaks from within the schools. So on October 5th, I issued an update to my earlier recommendations, which allowed for full in-person school for secondary grades. The recommendation for strict universal use of face masks continued. We did have outbreaks of COVID-19 among school students, but they were for the most part related to extracurricular social gatherings. And in some cases, they occurred among sports teams. It was not clear whether or not they contracted the disease during supervised sporting activities, or if it was related to other social activities among team members. There were outbreaks related to events that were not sanctioned by the schools, like Halloween parties, unofficial homecoming dances, holiday parties, and sleepovers. Overall, schools have been successful from an infectious disease standpoint, and we attribute much of that success to the use of face masks. Our disease control staff have always had a strong partnership with our schools, as there have been issues with various communicable diseases among school kids every year. That alliance is now even stronger with the relationships that grew between the superintendents and myself through some very challenging times. I will tell you, I have a new appreciation for our school superintendents and the challenges they face. After coming through such a horrible year for so many people, I am so glad that we are now busy vaccinating folks, that everyone now over the age of 16 is eligible for a vaccination, and that vaccine supply is rapidly increasing. It's been wonderful to see the tears of relief as grandparents receive their shots, knowing that they can safely hug their grandkids again. It's been gratifying to see the renewed enthusiasm among our own health department employees and our partners as they work on the vaccination effort. For me personally, it was really nice to sign orders for vaccine instead of orders restricting people's freedoms. I just want to take a moment to strongly encourage anyone who has not yet been vaccinated to get it done as soon as possible so we can all get back to a more normal life. Like just about everything else in this pandemic, vaccination is more than just a personal decision. It's a decision about how we protect one another and how we all work together to win this war. We understand that some people may still have questions or concerns about vaccines. We're more than happy to discuss these with anyone. We want people to be well informed. We are still really nervous about the variant strains of coronavirus circulating in the United States and in Alabama. And we are concerned that COVID-19 cases are on the increase in several states. And it's a good chance that it could still happen here. So while the statewide face mask order does expire today, I'm standing with the state health officer and with the governor in strongly recommending the continued use of face masks in public places or in any situation, public or private, where you are in close contact with other people. unless you know that all of you have been vaccinated. The main theme of this year's National Public Health Week has been building bridges to better health. There are several sub-themes to this, but I want to emphasize what I believe to be the most important: the bridges that we have between each other. I've talked about our many allies in this war against COVID-19. We were better positioned to deal with this pandemic early on because of the relationships that existed beforehand. We are better positioned now to face the many public health challenges ahead because of old alliances that were strengthened and new alliances that we forged. Incidentally, for the students in the audience pursuing a career in public health and who are our future public health leaders, this is my advice for you. As soon as you get into that career and assume a leadership role, be sure you get to know your elected officials, other community leaders, your nonprofit communities, and other stakeholders in your community. Cultivate relationships and alliances. Seek input and listen. Expand public health capacity through partnerships. Looking ahead, the Jefferson County Department of Health will be transitioning back to more of the work we were doing before the pandemic and focusing on strategic priorities that are just as important as before, and in some cases are now more critical than before, such as overcoming the far-reaching health consequences of centuries of racism and promoting health equity, addressing the ongoing epidemic of drug addiction and overdose deaths, addressing the epidemic of violence and homicides in our community, and promoting an environment, a built environment and natural environment that fosters a healthier and more sustainable lifestyle for everyone. These continue to be a few of our leading issues, in addition to the well-established and more routine work of the Department of Health. And just like the COVID-19 pandemic, these are battles we cannot win alone. We need allies. But with allies, it is possible to have successes in these challenging areas and more. Finally, as is our tradition, I want to recognize this year's Public Health Champion. During Public Health Week each year, the Jefferson County Department of Health gives out a Public Health Champion Award to a local organization that is not our regular public health agency or a healthcare organization per se, but nonetheless does good work in promoting health in our community. So many in our community have done such heroic work related to the pandemic, and many deserve awards. But this year's award goes to the Jefferson County Emergency Management Agency. They are an ally that came to our aid early, just like the United States came to the aid of Great Britain in World War II. And they've been a steady partner and supporter throughout this past year. And for many years before that, they've been an important partner in helping our health department and our whole community maintain preparedness for a variety of emergencies that threaten our health. Thank you.
Dr. Wilson, thank you for the award. It is greatly appreciated. And on behalf of the Jefferson County Emergency Management Agency Director, Jim Coker, and all of the members of the EMA team, I'm honored to accept this award. As you mentioned, it has been a much larger effort than just the JCDH and us at the EMA. Literally dozens of exceptional individuals from across and outside of Jefferson County that make up our unified command response to COVID-19. And without all of them and the incredible work that we've done over the past year, without them, it would not be possible. So once again, thank you for the award on behalf of our agency and all the people who make up the response effort. And I'll turn it back over to Dean Irwin. Thank you.
Thank you, Chris, and congratulations to you and the Jefferson County EMA on the Community Champion Award. Very well deserved. Thank you so much, Dr. Wilson, for a great presentation on the state of the county. And thank you for reminding us of the breadth and depth of the Army that has been engaged with COVID for the past 14 months. We are in good hands with you as our health officer and with the Jefferson County Department of Health leading the way. Thanks to my fellow webinar participants, Dr. Mike Sag, Chris Tate, and to Chris Corson, and to Sabrina Hagan, Chris Sima, and the Office of Public Health Practice at the School of Public Health for managing this webinar. And thanks to all of you for taking the time to join us today in celebration of National Public Health Week. Be well and take care.